Hi guys, welcome back to my channel. This is Inday Changge, your nurse in charge. So on this vlog, we are going to talk about how are we going to easily pass COVID nursing exams. I'm going to give you those mnemonics that I'm using whenever I'm answering COVID nursing question exams. And I hope this video will gonna help you in your nursing examinations, especially that I know it's already online class. And I hope this video will. By the way guys, if you are new on this channel, please don't forget to click like on this video and subscribe to my channel. I'm also open to receive any comments that you want to tell me, especially if you want me to discuss a topic in nursing that you are having a hard time. So without further ado, let's start after the intro. Yes, we've talked a million times already about this COVID-19. But what is exactly COVID-19? Most of you already aware on this COVID-19, but maybe you need some mnemonics in order for you to remember this all the time. Just to give you a brief information, COVID-19 or coronavirus 19 is originally from Wuhan, China, and they said that this came from bat or from a kind of species or an animal. This is actually a new disease which is rapidly growing, and its effect globally is really alarming. The effect is rapidly evolving and it might change also in the future. According to WHO, coronavirus came from large group of viruses with a genetic material. And according to some researchers, this COVID-19 or coronavirus 19 is new and haven't seen in human. This COVID-19 tremendously affected the healthcare world, and its outbreak is unexplainable. Actually, it has been years when the corona attacked the world. The first attack was in 2003, wherein there were a lot of people who were affected by the SARS-CoV. The other attack was in 2012, which really affected people in the Middle East, especially Saudi Arabia. And this corona is MERS-CoV. Then another type of corona attacked the world in 2019, which we named the novel coronavirus. The actual name of this novel coronavirus is SARS-CoV-2. That is actually the actual name. But later on, they called this disease as COVID-19 because this is already the actual illness which was named by the WHO. Just to give you a brief history, the virus attacked Wuhan, China in December 2019, but there was a global problem already or global emergency in January 2020. Initially, the attack of the virus comes first from an infected animal to human transfer. And that transfer is medically termed as zoonotic spiller events, or the transfer of virus from infected animal to human. Up until this time, the transmission is still unknown because the transmission can be droplet, contact, or airborne. But if you are in the examination and you have all these choices with all of the above, just get that all of the above because it can be transferred through droplet, contact, and airborne. However, if you only have two choices between contact and droplet, choose the droplet because according to WHO, the transmission of this virus is through droplet. Actually, the incubation period of this disease or the event from the exposure from virus to the development and symptoms is 5 to 6 days. But we are actually monitoring the exposed patient until 14 days. Some patients are actually asymptomatic when they are exposed to that certain virus. However, to some, the development of disease is from mild to severe, or it affects some organs of the body or other systems. So to sum up the introduction, we have mnemonics corona. C is corona, that is a Latin word, means crown, and the appearance of that corona is like a crown. O, the group at risk for this disease are actually the older people and for those people with underlying medical condition, which can be developed into multi-organ failure. R, the initial symptoms of this coronavirus disease or coronavirus or COVID-19 is respiratory illness. There is a mild to severe problem in the respiratory tract. First, from cough to the development of shortness of breathing until the development of lung failure. So C-O-R, now it's O. O is organ failure. As I've mentioned earlier, this COVID-19 can be developed and can complicate to multi-organ failure. That includes the respiratory system, the cardiovascular system, the liver, the kidneys, and even the neuromuscular system. N is corona is a newly discovered virus, which they call in the beginning a novel coronavirus. And the last letter is A. The primary prevention for this COVID-19 is through alcohol-based hand rub or more effectively with hand washing. So we've discussed what is corona, its transmission. Now, let's proceed to the signs and symptoms. Here in the signs and symptoms, I will just give you 3 letters. I'm going to share to you mnemonics CSF. 1C, 2F, 5S. 1C, cough. Common signs and symptoms of COVID-19. Number 1, there is cough. As I've mentioned in the beginning, there are respiratory illness or the COVID-19 starts from respiratory illness wherein the visible symptoms is coughing. 2F, fever, fatigue. Since COVID-19 has an infection to the internal part of our body, of course, there will be inflammation and there is an increase in the laboratory values, especially in the WBC. Therefore, there is fever. And this COVID-19 will affect also your musculoskeletals. Thereby, there is fatigue. Now, let's start with the first S. S, shortness of breathing. S, sore throat. S, sense of smell and taste is lost. S, skin rash. This skin rash is not common to all of the patients, but you can see this to patients who are really in this complicated part of COVID-19. The last S is severe. There will be severe pneumonia signs and symptoms, severe organ failure, which could lead to death. So there's next question. How are we going to diagnose or to verify if a patient is positive COVID-19? First is the RT-PCR or the reverse transcriptase polymerase chain reaction. It is being taken through swab, through nasopharyngeal or oropharyngeal swab. In this test, they are actually checking the genetic fingerprint of the virus. Another one is the blood test serology. In this test also, you are going to check if you were infected before. You might be infected before, but you just didn't develop the symptoms of this disease. So you can check yourself if you were positive before by checking it through serum. The next one is chest x-ray. In the chest x-ray of a COVID-positive patient, you can determine diffuse pulmonary edema and fibrosis. Also, you can determine patient's vital signs. The RR is increasing, PR is increasing, temperature is increasing, and O2 saturation is decreasing. So, how are we going to treat COVID patients? Actually, there is no definitive treatment yet for COVID-19 except for supportive treatment. So I'm going to give you another mnemonics, which is the A, B, C, D, and E. A is for assessment. You cannot actually give your supportive care without assessing your patient. Treating COVID-19 patient is already focus-based. That is depending on the symptoms of the patient. So the doctor needs to assess everything in the patient so that they can have a good plan of treatment. So A, assessment. Letter B, apart from the supportive treatment is breathing half. So as I've mentioned earlier, you need first to assess the patient in order for you to give your supportive care. And since COVID-19 is actually presenting pneumonia symptoms, you need to improve the breathing of the patient. So do breathing half. Letter C, chest percussion. Later on, the patient will develop a lot of discharges. So you really need to assess and give a supportive intervention, and one of these is the chest percussion. Letter D is deep coughing. You just ask the patient to deep breathe and then cough. Letter E, elevate the head of bed if needed. This is actually in the early stage of the disease. However, if the patient is already at his latter stage of the disease, you may do prone positioning to the patient. Why prone positioning? Prone positioning actually enhances the lung expansion. And aside from this, it improves the patient's oxygenation. According to some researches also, this prone positioning will let all the discharges to fall down through gravity. So if the patient is in prone position, the sputum can come out easily. But this prone positioning is depending in your hospital protocol. I'm not saying that you can automatically put your patient into a prone position because that is also depending on the doctor's order. So you need to collaborate with the doctor on how are you going to enhance your supportive treatment. Oh, I forgot to add. There is also letter F. When the patient is already developing complications, especially respiratory complications, you need to focus on the mechanical ventilator of the patient. You are not an RT, you are a nurse, but you need to know these things, the mechanical ventilator of the patient. You need to be aware that the setting of the mechanical ventilator should be in low tidal volume. And you must need to collaborate again with the respiratory therapist in your hospital. Once the patient is no longer responsive to all of the treatment or to all of the supportive treatments, the doctor actually is ordering for ECMO, and we're going to discuss that ECMO to the future vlog. The last one on the list is how are we going to prevent COVID-19? And this is vital in our nursing profession because one of our tasks or responsibilities is giving health education to all of our patients. So we have another mnemonics that is A, B, C, D, E, until J. Sweat. Yes. So letter A is assessment. What are you going to assess? Assess for the travel history, for any swab results or the RT-PCR results. Also, assess if there is blood serology results and antibody results. Assessment of the patient. We also need to note if there are already presence of symptoms of the patient. So that is assessment. Nursing process, do not forget, there's always assessment. So letter B. Letter B is be sure to wear your PPE. For healthcare professionals who are always dealing with COVID positive patients, do not forget your PPE, especially your N95. And for those patients who are in the hospital, let's remind them to wear face masks. Even the public. Letter C is cover your nose and mouth whenever you cough and you sneeze. This is to prevent the transmission of the virus through droplet or airborne. Letter D is disinfect surfaces. As I've mentioned earlier, the transmission of the virus is still undefinable. So let's think that it's transferred through droplet, contact, and airborne. But I repeat, in the exam, if you are already trapped with droplet or contact, choose droplet because that is in the WHO website. Letter E is environmental assessment. As I've mentioned on the assessment area or letter A, always ask the travel history of the patient or assess first the place where you want to go. Letter F, we mentioned earlier that we are doing supportive treatment or supportive care for the COVID-19 patients. So let's not forget their food. Give food that are high in vitamins, especially vitamin C, and give fluids. For patients with symptoms of COVID-19, they are suffering from fever. So we need to give them extra fluid to prevent dehydration. Letter G is give vaccine. There are already vaccines for this COVID-19. So make sure that you are having the vaccinations or your patient has. Give vaccine to patients, especially if it's not contraindicated. Letter H, hand washing. Hand washing in COVID-19 disease has a vital role because you are cleaning your hands, and this is actually the primary prevention for COVID-19. And your environment must be clean. Letter I is initiate social distancing. I know this social distancing is not really being followed globally, but as a healthcare worker, you have the right to educate the citizens. And letter J, just stay at home. If you don't have any important thing to do outside, just stay home. I hope you guys are recollected on what is COVID-19 is, and I hope that this video will going to help you in your nursing examinations. Again, please don't forget to click like, comment, and subscribe to my channel if you are new. If you need more strategies on how to easily pass nursing examinations, please check my other videos. Thank you so much for watching. This is Inday Changge, and see you again on my next video. Bye!